Welcome to the Metabolic Health Docs YouTube channel. And today, guys, I have another patient testimonial. And that testimonial will come from Carlton Jones. And today we're going to talk about three topics: gout, your blood pressure, and food addiction. So, if you've had any success with a low carb diet in dealing with those conditions, this may be a great time to share in the comments, because guess what? Somebody needs to hear from you. Somebody needs to know that it's not just Carlton who's benefiting, but there are others who can they can hear from, and we can inspire other people. So I really appreciate you coming to this video, my friend. And I guess we'll just start off with the most obvious question. How did you find low carb in the first place?
Good day to you. I first found low carb really about 25 years ago with Atkins. And I did Atkins. I had some success, but I wasn't able to stick to it for the long run.
Mm.
And from there I did everything from vegan, vegetarian, no meat for a couple of years, lots of beans and lentils. So I just tried a lot of things to try to lose weight, get the blood pressure under control. As far as the gout, I thought that was something I would just have to live with for the rest of my
Yeah,
life.
that's right.
3 or 4 times a year, it was just I couldn't walk for a couple days, lots of Advil, and then after a week or so, it kind of goes away. So
Yeah.
I'm just looking for solutions. The big breakthrough for me, one of the big breakthroughs, came from a gout flare that lasted about
Mm.
3 months. So I was in the bed for 3 months, could not walk, barely could get out of bed, and I just read and read and read, and I finally came across psychosomatics, the brain and body connection.
Wow.
And for me, I had tried the cherry juice, not
Mhm.
eating meat,
That's right.
shellfish. I don't drink, so that wasn't the issue, but something was going on. And at the end of that 3 months, when I could walk again, it was like, okay, this is the last time. And for me, it turned out that it was stress related.
Mm.
I had stress related gout. I thought it was always uric acid because,
That's right.
for the last 20 years, my uric acid was always elevated. My uric acid is still elevated, but I no longer have gout flares. My last one was that episode in 2019. So once I found out, oh, stress related, I think in the last 5 years or so, people really started coming to stress and weight loss.
Hmm.
Because before, you never really heard about stress and weight loss. It was
That's
like
right.
calories and, all the foods you eat, but nobody was really mentioning stress. But once I, healed my gout from reducing my stress, that was a page turner for me. See, fast forward to this past spring, actually, I'm working out hard, 5 days a week, and it's like this weight isn't coming off. So I
Hmm.
started watching videos. I run into carnivore. I'm like, that seems a little extreme, And
Yes.
granted, at the time, I was eating, 5 to 8 cups of beans and lentils every day. Like that was basically my main diet because while I was vegetarian, I actually didn't like vegetables.
Hmm.
So I went the beans and lentils route. Um, so I'm like, oh, carnivore. So I'm working out with my trainer, sweating hard, and I'm like, I just want to burn this fat. Like
Hmm.
I want the work I'm doing to burn the fat. And he's like, well, maybe you should look at keto or carnivore.
Hmm.
And I had been looking at hundreds of videos on keto and carnivore, and I'm just like, I wasn't quite sure. But once he independently said that, I was like, you know what? The next day I did it. And I had run across you on YouTube,
Hmm.
talking about the diet and your nest. And it's like, you know what? I already know stress is like
That's right.
far more important than anybody ever can imagine. And so now it's like I did it. At this point, I'm on day 92 so
Nice.
of doing carnivore, and wow, I would say and for me it's not even the weight loss. There's two big wins that I'm like, this is amazing. One, I've been riddled with anxiety since I was a
Hmm.
child.
Wow.
And this is the first time in my life I was not worried. I was like, and it was after about 2 or 3 weeks, I was like, I'm not worrying. Like, what is going
Yeah,
on?
what's
And
happening
I
here?
tried to think about something that I would worry about, and it's like my brain just would not let me worry.
Nice.
And I was surprised. I mean, because I had heard about it, watching the videos. I'm like, these people are just saying stuff, or they're taking some pills or something. But when I experienced it, it's like, oh, this is real. I was just amazed.
Yeah.
And another guest you had on talked about food addiction, and she shared her story, Joan Ifland. She
Yes.
shared her story of how she was on processed foods, and when she got off of them, her family life, her dynamic, her personality, it all changed.
Hmm.
And I was like, is it possible? I know I've had a sweet tooth. That's what we always say. Oh, you got a sweet tooth. Well, the reality is it was an addiction. And
Mm.
that went away as well. You know, I ended up joining Joan's addiction reset community, just amazing. And I was just so with between the anxiety and then joining Joan's program, it was like my life had changed. People talk about freedom and peace and all these types of things, and I was experiencing them for the first time in my life. And it's with Joan's program, the Addiction Reset Center. There's pretty much 24/7 support.
Hmm.
And I would tell Joan, I've spoken with her, it's just the fact that it's there and I know that support is there makes all the difference in the world. That was one of the big items. And the other item was that I, for the first time in my life, said I was an addict. And the
Mm.
way I looked at addiction and addicts, it was like, oh, that's a choice they made, with the heroin or whatever the drug of choice is. I wouldn't make a choice like that.
Hmm.
But after really learning about what's going on with our food, it's like that's an addiction.
That's right.
Like, I would try a diet, but then it's like you do it great for a couple weeks, and then it's like I want some cookies or I want some
Wow.
cake.
That's right.
And now I haven't had any of that stuff in 90 days. I've had birthdays around me, birthday cake, fresh baked cookies, and it's like,
You're good.
yeah, I don't care. I'm good. Yeah, I don't even have a desire. And I go and I would smell it just to see if it triggers anything. Nothing.
Nice.
So it's truly amazing for me. And again, I'm still surprised. I honestly did not think like, oh, I'm gonna go in this and get rid of all crap. I did not
That's
think
right.
that.
That's
I
right.
was just trying something else, which I've
That's
been
right.
trying since I was a kid. And this, it really worked. And
It
I have
worked.
a pretty constant smile on my face because it's like I struggled for 40 years with
Wow.
this since I was a child. And here we
And
are. And
and here we are,
yeah.
and restoring hope. And for those who uh, heard this testimonial, that is restoring hope. One other thing I wanted to ask you about before I provide any comments is this blood pressure issue. So now that you're doing, it's only been, a few months, but where are you landing with your blood pressure? Because I don't think you're taking medicine. So, how do you feel about that issue?
I feel good about it with my blood pressure. It's borderline,
Yep.
and I know I believe once I lose the weight,
Hmm.
my blood pressure, arteries, everything is just gonna have an easier time.
Yes.
But yes, I no medicine. Just like with the gout and everything else, I'm just not a big fan of the pharmaceuticals, and I know there is an alternative way,
Yes.
and that's what I was searching for, and I found them.
That's right.
And that's amazing, and that's where these types of YouTube videos and podcasts, it's like this is very good for people, because if you just don't know, you just don't know.
Just don't know.
Like I said, I in no way thought I was an addict to anything,
That's right.
but yet I was.
That's
And
right.
it was hard initially to say that and to
Hmm.
accept that, but once I saw the fact that the cravings went away, anxiety went away when I went off processed food, like Okay,
That's
addict, call
right.
me whatever,
That's
but
right.
I feel free and I feel good for the first time in my life. So, but yes, I think as the weight continues to go
Yeah,
down, and it is going down at the kind of recommended 1 to 2 pounds a
that's
week.
right.
Of
That's
course,
right.
I want it to go down, 8 pounds a week,
That's
but
right.
I'll take the 1 or 2 pounds a week, and I want to be consistent for a year or two, and then grow
That's
that to
right.
5, and really just staying the course,
That's
being
right.
consistent over time.
Absolutely.
That's my newfound mission there.
A lot of great nuggets. I'm definitely gonna add a layer of doctoring just to make sure everybody walks away from this video with a better understanding. And I will say this, it takes longer for most people who have blood pressure issues. And I also say that when you're borderline, that's a great place to land when you're doing lifestyle. Some people, if you come to my office with a 200 over 100 blood pressure, we may have to bridge you with medicines until we are healed. And again, of the things I treat, um, you will absolutely take a little bit more time for your blood pressure. Some things like diabetes can be reversed quickly. The mental health benefits can occur quickly. So it just depends on the individual. So but let's start my comments with gout. Many people, when they think about gout, they know that the thing we measure in the blood is uric acid. And it's important that people know that uric acid is a byproduct of something called purine. So your body kind of breaks purine down into uric acid. And if we produce too much of it, or we're not getting rid of it, you have the risk of that uric acid building up in your blood, getting into your joints, leading to gout, or in your urinary system, leading to uric acid kidney stones. Although the most common kidney stones are from calcium, it is possible that that uric acid, those crystals can come together and form a little stone, which is never fun to have. So now, as a conventionally trained doctor in America, I was trained that if you eat foods that are high in purines, that's gonna cause problems, and that would be things like red meat and seafood. Thankfully, thankfully, um, the higher uric acid that comes from these food sources are not as important as the inflammation that can flare up your gout, right? And that's
Yes.
why you're able to literally be a carnivore and not have a gout flare. It doesn't make sense based on what you read, right? Don't
Right.
eat red meat. Well, should I eat red meat? Consistently, and my patients with gout do the same who are doing keto or carnivore and they don't have flares. So even in the setting of red meat and seafood, gout flares are not common for people who are on a lower carb diet. So that's really important to kind of understand because what they found is that the inflammation is a bigger enemy as opposed to that little bump in uric acid you get from these foods. There are exceptions, and there are people who cannot get to where they need to, and they still have to take medication, but they'll be much better off because they've eliminated the inflammation. Additionally, there's one other thing to keep in mind. When you go from a standard American diet to a diet where you're becoming keto or carnivore, your ketones are going to be spilled in the urine initially because your body's not used to it and not used to using it as fuel. And when that's happening, the uric acid, which is also spilled in the urine, is not going to be spilled as effectively. So you can actually build up a little uric acid when you're in the adaptive phase, which takes a couple of weeks. So the goal is to either go slow, maybe not doing less than 50 or 30 carbs. Maybe you start at 100 if you're used to doing 200 carbs, and then you go to 75, 50, you ease into it. So you give your body a chance, or you just take something like allopurinol while you're going through that adaptive phase. So at the end of the day, people who are in this dietary pattern don't tend to have flares. The only other asterisk I'll throw in there is that if you're having a history of gout that's pretty severe, you don't want to go in and out of ketosis a lot because every time you do that, you'll have to go through that adaptive process again. So it's best to just try to be as consistent as possible. The second thing you mentioned was anxiety. Other authors like Dr. Georgia Ede, and by the way, Dr. Ifland wrote the book on processed food addiction, literally wrote the book. So she's a great resource. But Dr. Georgia Ede has shown us, and Chris Palmer and others, that when you stabilize your blood sugars, instead of having up and down sugars, you'll end up not having up and down mood. So having a stable blood sugar really is effective. So people who struggle from stress, anxiety, and mental health conditions benefit tremendously. We talked about high blood pressure. And when you reduce the carbs, you reduce many things that can affect your blood vessels. Number one, obviously, you reduce inflammation. You also are not holding on to as much salt because when you do low carb, you kind of get rid of salt from your body and you reduce constriction. So, but it takes time to heal those blood vessels, which normally make nitric oxide, which opens up your arteries. But in this setting, it takes time for your arteries to heal so you can start making nitric oxide again. So I think that's something to keep in mind. And finally, and arguably for many people, the addiction, right? So Carlton, you said, hey, I didn't know I had an addiction issues. And the reality is, I think most of us have a little bit of that. I mean, put something in front of us, most of us will struggle. You're doing much better with that. But the reality is, you handle that by not having up and down sugars, because when your sugar is high and then the insulin makes it go down, then you're going to get hungry and then you're going to want those things. So number one, the low carb diets, low carb keto carnivore will help in that regard. But this is addictions are diseases of the mind, right? And so I need some mental health support, which is what Dr. Joan Ifland and her group does. So one of the things so I've always been a fan of hers and her community that supports people. So when I created my link tree, which I'll share in the notes, there are two links that deal with Dr. Joan Ifland. One is the one where you can actually get the support and join a group like Carlton did. It's called the Addiction Reset Community, or ARC abbreviated. And you pay a monthly fee to have like hours and hours of support, just like you're going to AAA. Additionally, there's a link to the questionnaire to see if you have a processed food addiction. So you may want to go to that first, fill out the questionnaire, and if you find that you fit into that category, you may want to go ahead and get that support. So I really appreciate you coming to this video, Carlton. Any final comments before we wrap up?
I would say don't give up. Be your biggest cheerleader. Keep researching, keep learning. Don't get stuck in any particular dogma, and listen to your body. Your body knows best. It knows what's going on in there more than any scan or anything else can ever know. So listen to your body. Don't give up, and you will absolutely get there.
All right. Well, I appreciate that. And for those who joined us today, like, subscribe, share, but more importantly, share your successes. If you've done this already, if you haven't done it, share your concerns. And if you have any questions, I'll be happy to respond to those as well. So thanks again, Carlton, and all those who joined us. And until the next video from the Metabolic Health Doc, continue to be safe, be well, and continue to protect your nest.